the GFAP alums. I see many of you in the room. It's wonderful to have you come to this event. GFAP and CHAS are closely linked. It's our graduate program in the center, so it's really a pleasure to see you all here. So I am just going to make a few remarks. I wanted to start by saying that Harold said he was mad at tomorrow, but now I'm really mad at Harold. Why is he so darn funny? And why does he come off as so sincere while he's being funny? I mean, it's just like this incredible combination that's really hard to beat. So yes, I'm still mad at you. So I want us, I put this together with Harold and Jean. We were a subcommittee and thought about all the great people we could invite in. And my thought was, if you're going to have a 50th anniversary on CHAS, we should have something, equity should be, paramount, right? Equity, and obviously the title of the conference became Equity and Choice. How many of you know of Luana Day? Some of you were maybe there. Some of you know of her writing. Luana Day, Ronald Anderson. The Anderson and Day models are still used today. They're really important. And they did just really some path-breaking work in the 1970s and still, have continued to work on it, on equity, thinking about equity. And so I thought, we really should pause and spend some time on a panel really thinking about equity. And I have on this slide is's versus oughts, and what I mean by that is it's kind of in the ethical literature about is's and oughts, but I kind of experienced it through interviews with policymakers. And when I've done a number of these over the years, as my area is health policy and health politics, and so I go and talk to policymakers and try to figure out how they made decisions, what were the big factors that influenced their decisions. And I often will ask them kind of, well, what did you really want to do? What do you think we should do? And then, what did you actually do? And that's kind of where the is's and the oughts come, is that what I found over the years is policymakers and policy wonks, people involved in the policymaking process, really enjoyed talking about what they thought we should do. That was really important to them. Obviously, the whole reason they're in the field is they feel strongly about what we should do. The oughts were really important to them, and they had, I think, strong opinions, but were still open to new ideas. They wanted to talk about what should be done. But they were every day facing the is's, right? Which is the what was, in their view, what was possible. That was political feasibility, but also just in terms of the budget or the policy pragmatics of it. The is's are really important, and they should take that into account. But it was this kind of a trading off of is's and oughts. And so I kind of think that Julia and Norm provided a nice sort of is's and oughts, if you will. So Julia kind of gives us a sense of, well, what is the American public? That's important, right? In a democracy, how does the American public think about this question of equity around health? Health, what she was able to tap into, which I think is really quite interesting, is, it's different whether they think about equity around health or health disparities versus equity in health care or inequities in healthcare treatment, right? Sometimes we hear it that way. And so I wanna touch on that a bit, and but I also think Norm's talk is really important, because along with what Sherry Gleed was talking to us about, how she said, sort of, it really was wonderful to hear her say that the work of all the foundations and CHAS and different centers and basically researchers, because we feel so invaluable the vast majority of the time, it was incredible to have somebody say, oh, your work was really important and really made a difference, that they could come up with these, they could use the data that had been done and use the research and really put it into action. I think that having really good moral and ethical arguments that is translated for the public is really important as well. And so I appreciated Norm's talk about what are the moral arguments for why immigrants should be included in the ACA. And I think he makes some really important arguments, and that should all be part of the debate, and we can use that and really push back and forth. So I think the is's and the oughts are both important. having said that, when my daughter asked me last night, sort of, what are you doing, Mom? And I said, well, I'm preparing some remarks on a panel. And she said, well, what's the panel on? And I said, well, it's about equity and fairness. And she said, well, why? Because you always tell me, life isn't always fair. And I reminded her that the household she lives in is not a democracy. But then Julia's comments made me pause, because I thought, wow, maybe us parents are actually raising these adults who say they don't care about fairness. That we tell them fairness, it doesn't count in society. And then I realized, oh no, it's my mother's guilt again. And sort of, we blame mothers. So anyway, I digress. Okay, so let me just say a little bit about this finding, though, that Julia found that I think is really important and potentially really troubling as well, right? That people don't care about fairness. I guess knowing, it's interesting, because even though I say that to my kids, they always tell me, that's not fair. And in my husband's response, his response is much better than mine, which is, you know what? Adults complain about fairness all the time, too. He says, I hear it every day at work. They come into my office and complain about this or that, or it's not fair. And so just intrinsically, I think people do care about fairness. And I have no empirical evidence to back it up with. But I'm wondering if part of it is in your final graph, and I know you did the kind of targeted example, they dislike targeting. It's kind of fairness is your sort of basic value structure, right? And you believe in a fair distribution according to how you define it, right? And that's where we're really contesting. That's what's being contested, is how we define it. So obviously in the healthcare field around the ACA, we could distribute the benefits for the ACA according to need or liberty or some other value-based structure. But that wouldn't necessarily mean that we want an equal distribution, right? So I was a little bit troubled in the end on one of your slides. I think you had fairness and then kind of equals is equal outcomes. Because I think if you frame it that way, and I know with your experiments you didn't frame it that way all the time, but I think if people interpret fairness as really talking about an equal outcomes, that makes sense to me that a lot of people in America are against that. I think, especially in the healthcare field, I think from studies that I've seen, the vast majority of the people care about healthcare being distributed according to need, right? So that when they have a healthcare need, they can access the healthcare system in a efficient and hopefully more equitable way, right? That they don't believe that people that don't have resources should not have access to that system when they're in need. And that doesn't mean an equal distribution at all, right? That would be silly. Everybody has different needs, and we want to match the needs with the outcomes with the needs. Let's just think a little bit about the conceptual frame for equity, and that I think relates to Norm's comments. And here I wanted to just talk briefly about the affordability question, which Norm didn't get a chance to talk about, but so maybe I will pause and talk a little bit about that. What I think is important in thinking about the ACA is or any policy, right, is that there's a financing side. How do we finance it? And have we financed the policy in an equitable way? And then there's the distribution of benefits, and have we distributed the benefits in an equitable way? And that gets very, very complicated quickly, right? We can think about the distribution of benefits in terms of who's eligible, and that's really what Norm focused on, that some people were explicitly excluded from the bill. But we can also think about the distribution of benefits in terms of what we decide to distribute and whether everybody has access to the same set of benefits, which they don't. Even though we have an essential benefit package, so that's really important. And then how the distribution of benefits is distributed, right? And whether people have access to different qualities of care. So it's those different dimensions of equity that I think are all important to think about. And then finally, when you bring those all together, we want that distribution of benefits to be distributed efficiently, and that we don't have a just system if we're just throwing away money. I think Norm made that point really well and has made that point really well in other work that he's done. So on the financing side, one thing that I think is just important to sort of hone in on is that, and it's very obvious, but I think sometimes we lose sight of it, which is if we had in this system, because we came up with the structure of the ACA, because we structured it in the way that we did, that it's individual purchasing to achieve universalism, right? That's the health insurance exchanges, that people go to the exchange to purchase. The question then becomes whether the level of healthcare is affordable for individuals. We kind of look across the income distribution, think about affordability for individuals. And that, I think, is drastically different from if we would have done something like social insurance, where we think then more about fairness and contributions across the whole income distribution. This looking at the subsidy to health insurance exchanges sort of makes us focus in on this very targeted means-tested approach in a way, even though we did it to achieve universalism. So there's sort of this irony in the way that we set it up. And so I want to argue that, if we did something where we thought about the collective distribution, that allows us to think more broadly about inequality in the U.S., which is a huge problem, right? If you just look at the income distribution. So that's another thing I do as a parent, and it was quite effective. I want to tell you all that when my daughter complains that my friend has this or my friend has that and I don't have it, I say, come here, look at where we are on the income distribution, and I won't point it out to you. I'm sure many of you are higher than me, but we're higher than the vast majority of Americans. It's really striking, actually, how poor people are in America. And that inequality, that level of inequality, we all know has been growing. And so it's hard to talk about fairness in the ACA without really first talking about we have these great levels of inequality, and we could be doing a lot more on the financing side to redistribute the burden of those costs, right? And then back to, though, the structure and how we kind of have means-tested targeting within our effort to achieve universalism. What that does to us, I think, is it forces us to ask these questions, which are very common in means-tested programs. What is fair for the target group? And when you're thinking about the target group, then it always poses this question of people just above 400% of poverty and people just below 400% of poverty that are maybe people just below who are less deserving than people just above 400%. And so you start really having conversations about deservingness and who should get the subsidy and who shouldn't, and how much that subsidy should be. And I think we just have to live with that as we move forward with the ACA. But it does put us in that boat. And so with the subsidies and the health insurance exchanges, when you get up to 400% of poverty, the expectation is that a family at 400% will pay at least 9.5% of their income on premiums. And then you have to ask yourself, is it fair that upper income Americans devote less than 2% of their income on premiums? Again, we could structure it differently, where we use the tax structure to provide the financing. If we think about benefits, am I in the red? I'm in the red, aren't I? Is that? I'm in the red. So I didn't keep my promise. So you know what?
Set a bad precedent.
It's okay. So let me just end with the other part of the ACA that you would think about in thinking about, is it an equitable distribution, is obviously the main thing that the ACA is doing, which is distributing benefits. And as I said, Norm talked about the who. I just want to say that something we really everybody else today was spending a lot of time talking about, which is crucially important, is the what and the how. And I think on this question of kind of the question posed for this panel was, does the ACA improve on equity? I think it really, in these areas, arguably really does. I mean, we have Richard Frank talked about the mental health parity. We have the basic essential benefit package. I think it really takes us many steps forward in that area. The delivery models has real potential. I thought Sherry Gleed's graph of just showing where the U.S. That the U.S. has spent more money but gotten more value, it was really useful, but to show how much of an outlier we are compared to other countries. And yet I loved her optimism that we could come down to there. So I think that's really the hope, right, of the ACA, that we will create a more just system by getting down to, at least where we think our peer countries are. So I hope we can move in that direction, and I'll stop there.
I'm Harley Grant. I'm with the AMA, but my question is not related to any of our policies. Professor Lentz, at the end of your talk, you mentioned the fact that you said your employer does not allow smokers. Is that right?
This is a new policy that Penn HR has just floated, and we're going to see where it goes.
Right. I'm just fascinated by that and wondering if there are any studies showing the benefits of that. And also, if you were to apply that to something like Medicare and said, you either don't smoke, or if you smoke, you don't get Medicare.
So there's a group of primarily economists working at Penn they're behavioral economists, and they've been doing a series of studies looking at the effectiveness of carrots versus sticks. In a range of sort of health-related areas. And they seem to think that sticks work pretty well. So I'm not quite sure where that leaves us from a fairness perspective. But I mean, that's the body of literature that I would probably first look to for at least a justification of this particular policy.
So I just want to get back to your presentation. It seems to me there's a kind of self-defeating character to technocratic liberal policy advocacy on some of these dimensions, that we start with, we're motivated initially by whether it's need or fairness or solidarity, by stories of people really having profoundly bad outcomes because they're uninsured or similar things. And I think of John Cohn's book, Sick, as an example of the stories that quite moving. And then during the policy debate, we present a very complex policy proposal to try to deal with those problems. And the conversation in public and also among us starts to drift into a very technocratic discourse in which the moral urgency falls away. And the fact that ACA is really about taking care of people who are losing their homes because they got cancer or whatever it is becomes lost. And how do we have a technically transparent and accurate conversation about policy without losing sight of the values that are on both sides of the debate, the things that people really are being moved by? I think it's a real challenge when we have something that's this complex that we're trying to change in public policy.
So the study that Elizabeth Rigby and I did on sensitivity to efficiency, in fact, one of the key findings that I didn't show you is that liberals and people who are initially supportive of redistribution of those targeted policies are exquisitely sensitive to efficiency concerns. So it's exactly the opposite. You know, the political rhetoric is, oh, those egalitarians, those liberals, they just want to, you know, solve social problems and they don't care at what cost. You know, there's this equity efficiency trade-off and they're all about equity. And whereas people who, you know, are on more to the right are motivated by efficiency concerns. And, you know, we're all sort of conservative egalitarians. Really, we'd love to redistribute, but we just can't because it's not efficient enough. But it turns out that's actually that's the opposite of what's going on. That the technocratic left is exquisitely sensitive to these discussions about efficiency. And although I haven't studied it directly, my guess would be that efficacy is also pretty moving to the technocratic left. This, by the way, is true not just in the US, but I think in many European countries as well. This is the direction that the left has gone in. And you know, I don't know how to solve that problem other than through deep introspection. But I think it's worth noting that the people on the other side of the fence want, I think, in a way, to use efficiency as a stick to beat egalitarians with. But they don't necessarily apply it to themselves. And I think just being aware of that and sort of not buying into that framing of the problem may help people who are more interested in equity stick to their guns a little bit harder.
Okay, we have 3 minutes. One more question before we break.
Just one terminological point. The trade-off is not between equity and efficiency. The trade-off is between equality and efficiency, and I think the distinction is really important to maintain.
Tell us, for those of us, the equality and equity distinction.
Equality is a measurement, something you can measure. It has numerical value. There are all kinds of statistics relating to equality. To the best of my knowledge, there is no statistic relating to equity. Equity is a moral concept. The philosophers and others argue about it. The term dates back to a work by Arthur Oken, the best-selling book, I think, that has ever come out of the Brookings Institution. And the title was Equality and Efficiency, the Big Trade-Off. And the vivid image that he used for making this point was a leaky bucket.
In fact, the title of this paper is Who Cares If the Bucket Leaks?